Ladies and gentlemen, a very warm welcome to you. You're watching another episode of Encounter. Today, our guest is Sophie Xu, who is a craniosacral specialist and therapist. Sophie, a very warm welcome to you.
Hi, Roshan. Thank you for having me here.
Sophie, please tell us, craniosacral, what it is.
So, craniosacral is, as the word says, cranio is the cranium, sacral is the bone at the end of the spine, and the craniosacral system is the system that surrounds the brain, the spinal cord, and the central nervous system. Yes, so I'm actually a craniosacral therapist, and I work also as an emotional release therapist because it is very linked, and as a corporate trainer and as a life coach.
So what is the relationship between how the nervous system along the spine with the release of emotions?
So I tell you the little story about how I discovered it.
All right.
Okay. I'm a mother of 5 children, and my 4th child was born in Austria with an anomaly in the cranium. She was born with a macrocephaly, which means an enlarged skull and an enlarged brain. So thank God we were there, surrounded by lots of specialists, but who couldn't find out what was the issue and what the syndrome was. So I discovered craniosacral therapy there at that time. A specialist was there, a therapist, trying to help her organic biological structure to reorganize itself, because not knowing exactly what it was, they had to be very careful, but still with a very holistic and energetical approach, they gave her the opportunity, they gave her body the opportunity to improve itself and to heal. So this is how all began. Yeah. So I found it amazing how she developed, because at the beginning, the doctor was saying she wouldn't talk, she wouldn't survive. Maybe they couldn't understand. The traditional medicine couldn't understand what was going on.
Yep.
And through this assistance, she could develop. Now she's 12, and she developed into a beautiful girl and doing her best in her evolution. Yes.
Is she having a normal life?
She's having a normal life. So I assisted her a whole year, like weekly, to her sessions, and it was at the beginning very surprising because the therapist wasn't doing much. She was just holding the baby, and I couldn't see much happening until she explained me what it was. So I will tell you what it is. Yes?
Exactly. So please tell us what it is.
Yes. So we are made up of 3 different fields, the body. Yeah. We have an energy field, we have the fluid field, and we have the tissue field. Yeah. The fluid field is known as the field that conducts energy in the whole body. It's the medium, we say. Yeah. It's a fluid, as we know, water is the greatest conductor of energy. So that will help the energy field to reorganize the tissues in the body. It means, just imagine the body being a fabric, which is interwoven, interrelated biological structure. And imagine at some specific part of the body, there is a strain, a restriction. Okay. So that will pull not only the tissue, that will influence the tissue not only in that zone, but it will have an impact on the whole structure. So usually when we have something, when we are in pain, a frozen shoulder, a locked jaw, some pain in the lower back, or even an emotional pain, what we do, we run to the doctor, we get something to cool the pain, but we don't sometimes take time to really go deeper and look for the roots and the cause.
Exactly. That's one of the main issues nowadays. It's always a short-term solution,
but
not getting to the roots of the problem.
Yeah. And this is where craniosacral therapy helps a lot, because it reorganizes the whole field. When I say the whole field, we as human beings, we are not only physical beings. we have the physical body, we have the energetical body, we have the emotional body, the mental body, and all subtle energetical bodies. Yes, this is another topic.
Of course.
So everything is interrelated and needs to be aligned always. And the biodynamic craniosacral therapy that I practice helps the body to find its alignment and its balance. So it improves the whole structure and promotes the well-being and the self-healing processes. So whatever the patient is experiencing, either he comes for some physical issues or some psychological issues, some emotional issues. Yeah, the point is not to. The aim is not to discuss long about it, because we are people that think too much, and this overthinking creates already stress.
Yes.
Yes. So it's more about get the body and the field to reorganize itself as fast as possible.
We were just speaking about origins, so please tell us, what are the origins of craniosacral studies?
Okay, so craniosacral therapy was discovered by John Upledger in the 70s. That was who was a physician and an osteopath. Yeah, and when he was making an operation, a brain surgery one day, he realized that the skull was breathing and had its own rhythm that was independent from the
heart
and from the respiration, the normal breathing. Yeah.
All right.
So he calls it the dynamic stillness, because he could see that the skull, the 24 bones of the skull, were like expanding and releasing, creating like a wave and energy into the cerebrospinal fluid to keep the fluid moving. So this fluid, which is produced in the brain, flows along the spinal cord down to the sacrum and up. So this is the fluid is there to release toxins and to feed the brain. So how magical nature can be, yeah? I always compare it to the ocean. When you sit on the beach and you look at the waves, you know that even if there's no wind, the waves are still there, and you ask yourself, where are they from?
Yes.
From this biodynamic structure. So the bones, the how you say, the bottom of the sea breathers. Yeah.
Yeah.
Same for the skull. So he discovered that actually this was linked, connected to the nervous system to our emotions to our mental body, the mental body to the tissues, and so on. Yeah.
And how do you become a craniosacral therapist?
Well, when my daughter was born, I knew I had a big shift, of course, yeah, because I was there with a handicapped child, and I converted myself into a therapist to help her. So I went through studies. It lasted 3 years in Vienna. So I was in Vienna, going deeply into anatomy and into the biodynamic field, into quantum medicine and energy medicine.
That was after your fourth child.
That was after my fourth child. Yes.
So you already had you had already 4 children, and then went through 3 years of studies at university in Austria.
At university in Austria, yes. And I was going through
Wow, hats off.
Yeah, it was. Thank you. It was a very hard time, because I was going through a divorce and through a very stressful moment of my life, and that's how now I use these experiences that have showed me that no matter how much stress there is somewhere, there is this inherent vital force within ourselves that are just there, and it's vital to go and boost it, or how would I say,
to give it a push,
awaken it,
to
exactly,
awaken it,
to
yes.
awaken it, yeah, and that is in each and every part of us, and every one of us.
Before we move on to other topics, I want to ask you, what is the main issue that people coming to see you in Mauritius, what is the main issue that you encounter the most?
Okay, so they most come with the stress, yeah? Everyone that comes in and you ask, how are you feeling? So some, if it's a woman, she will take the tissues very often, because sometimes there are no words to express what's going on within yourself, depending on what the person, of course, is going through in life.
It's a form of release.
It's a form of release, exactly. Some come with physical pain, with chronic pain, where they've been to the doctor, they've been taking too much medicine, and they can't see any change on the long term. Others come with their babies because they have crying babies and they can't understand what's going on, and they are themselves stressed and the baby is stressed.
Of course, okay.
So there are really different kind of people that come to me, yeah, for different reasons.
From what you have been explaining, it's always after something. But is there something which is more proactive rather than after?
So I think it's both.
Okay.
Yeah? Someone may come with an issue, and then the aim is to release the stress and expand the field so that it can reorganize itself. Someone may come because he's just aware that it's preventive.
Okay, that's more like maintenance treatment.
Maintenance treatment, exactly. Yeah.
So you have people also doing maintenance treatment?
So I have people. I have especially one person who does a maintenance treatment since 11 years, and she's a pharmacist living in Switzerland and is also here in Mauritius. And we've gone through quite a journey together, through some physical illness issues, etc. And yeah, and the person is transformed. Yes.
All right. Now I have to ask you, if one day I come to your practice and tell you, okay, I'm suffering from a lot of stress, I'm not thinking straight, I don't have clarity in my life, how would the treatment work? Is that, do you lie down? How does it work? Can you walk us through? I'm just curious.
Yeah. So we will have about 15 to 20 minutes talk. Yes. Sometimes the whole session, the first session, may be just talking, so that I can really hear into the person and listen to what is his need or what's going on.
Is
Yeah.
that like what they have to say, how they say their body language, and reading, trying to figure out what is really affecting them?
Yeah, and it's also because the person has to talk.
Okay.
Sometimes some people need to be heard, to be listened, yes? So before working on the table, it depends on everyone. It depends on each and every person. Sometimes there will be this verbal communication. Some other people, they can't just find words, they can't talk, so we lie down immediately. And so it is a light touch, hands-on manual therapy. So the person stays with his clothes on the table, and with my hands, I hold the cranium, I hold the head, and go into listening to this primary respiration of the skull. Yeah.
Are you able to listen to the breathing of the skull?
I am able to listen to the breathing of the skull.
That's quite something.
It is, yes. It is very deep, very subtle, and it's non-invasive. So I'm not
It's very
there.
sensitive.
It is very sensitive. So I'm not there trying to tell the body what to do, or I'm not there manipulating the body. I'm just there as a presence. Yeah, it's like sitting on the beach and looking at the sea and just checking the waves.
Yep.
Yeah, and feeling the wind.
All
It's
right.
as subtle as that. So it's very respectful, because the aim is just to invite the body to heal itself.
All right.
That's why I say, when people ask me, are you a healer?
Yep.
I say, oh, I don't like the term a healer. I like the term, I am maybe a channel who will help the people to heal, because we are all healers within ourselves. Yeah.
Yeah.
So now being in touch with that tides, with those tides, I can feel and diagnose and say where are the restrictions. So I can feel the flow, the fluid and the energy flow, if it's very fluid, if it's okay, or if it's somewhere stuck. So if it is stuck for example, at the neck region or at the back region, then so I will work locally on that spot.
What do you mean by work locally on that spot?
Working locally is paying attention to what is going on there.
All
It's
right,
like,
okay.
yeah, I always say it's like kids. I have kids, so I take this example, yeah. When a small child that can't talk, they don't have the vocabulary, they're going through some emotional stress, and they come to you and hold on your leg and cry like, mama, 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 and
Yeah.
starts crying. What do?
You have to try to figure out what's happening.
We have to try to figure out what's happening, yeah? So we hold the baby, we hold the child, and we try to listen to what is the message that you're giving me. It's the same thing.
All right.
And just by listening to what is going on right now, the baby, what happens, release happens. Because he feels listened to, he feels heard, understood, and loved. And this is what the body needs, yes? Stress means psychological, physical stress means that undergoing some pressure where I'm not good enough and I should have and I should do, etc., etc. So that causes inflammation.
Okay.
And inflammation, as we know, is the key word for diseases.
Yes.
Yes? So the aim is to reduce inflammation and thus releasing the central nervous system and the emotional body and the mental body and the physical body.
Wow, sounds magical.
It is.
The thing is, when you're able to listen to the breathing of the brain, it's different for everyone. So is it why you listen to people before so that you can interpret what's really happening on the outside but also on the inside?
Okay. So the breathing of the brain is the same for everyone. It has the same rhythm,
All right.
no matter how old the person is.
Okay.
From birth until the end, yes? This is the normal craniotidal, the cranial wave. What I listen to when people come, I listen to their patterns because their fascias, their tissues have stories, yes?
Okay.
So if I take example again once more on the shoulder that is strained, there is a story there.
Okay.
So people talk about their stories, yeah? What they have been absorbing and what's going on and who has said what and what kind of relationships I'm having, because it's mostly about relationships.
Of course.
What has been said, what was expected, what have I done, not done, etc., etc. So the pressure is there. So I listen to that to understand the pattern and help the person to transform and while being aware of what's going on.
What I understand is you try to have a reading of what is the current situation.
Yes.
You identify
Yes.
the spot where there is a need for a release.
Yes.
And then you go to that place to. So now I will ask you, how do you go about to release? If you have identified a place where there is pain, let's say it's stress or pain at my shoulders or lower back, and you've done a reading,
Yes.
you've identified where's the problem coming. What do
Yes.
you do next?
Okay. So the magic of craniosacral is I don't have to do anything. It's just that being there and inviting the body to reorganize itself works. So the stress and the strain automatically releases. So that happens on the spot without saying anything, because the body is magical, the body is super intelligent.
How do you work on the body? Is it something you transfer energy? Do you command it? That's a bit gray area for me.
Good. So I don't transfer any energy because the body itself is a powerful energy, has a powerful energetical mechanism. So I'm just there accompanying the body, guiding the body to flow better and to heal, because everything is there already. I don't need to give energy to someone. I think no one needs to give energy to anyone, because we are biodynamic beings. Yeah, it's like a tree. The tree gets its energy from the sun and the earth, and we are the same.
Okay.
So I'm there to offer a platform, a space to the body, saying, well, let's leave aside all the patterns, emotional, mental, and let's tap into the potency. Let's tap into the inherent vital force that is there. And
this is what I want to know, in fact. How do you guide another person's body to self-heal?
Yes.
Is it the technique that you learned
I
at
learned the
university?
technique, yes. It took 3 years to learn it, to learn that, yes. But it took 3 years to learn how to approach someone, how to approach this unbelievable, intelligent being that we are, yeah?
All right.
With much respect and delicacy. Yeah. So it's all about how to approach and how to listen and how to respond to what's coming to us. We learn to connect to different parts. We learn to read. We learn to channel. We learn to release, and that's it. And we help people just feeling better and better.
Does that mean you don't have any trouble in your life?
I do have. Everyone, we all have troubles because we come, as I said before, we all come with our patterns.
Of course.
And I think that we all struggle with the patterns more than everything else. If there were not all those patterns influencing us, we would have been absolutely free. I always say, even the monk that sits up there on his mountain and has no responsibility, no family, no house, no debt, no loan, no car, no kids, he is still trying to find his balance and realign because from birth he's carrying the patterns of generations and of the culture and of the social system, etc. So we are all parts of systems, and I think that health lies in the alignment of all the systems.
All right.
And finding peace in that, I think, is the key.
All right.
Because you will never be able to erase the problems. Yeah, we will never be able to make them vanish like that. But it's how do I react, or how do I position it myself, we say, I think, yes.
Sophie, please tell us, what has been one of your best experiences as giving guide/treatment to one of your patients?
Oh, I have so many of them in so many years. Let me just take the one that comes. I have two stories that come, yeah. First, I have a baby who was 3 days old and who had like a torsion in the physical body and lots of colics, yes, those classical colics that we hear. I won't get into the detail because it will be too long, but working 2-3 times with the baby could release all the stress, and the baby was sleeping like after each session 5 to 6 hours. Yes, so you could really see the release.
So are you saying that a baby was already stressed at 3 days old?
Yes, the baby is already stressed. I tell you why, because 9 months, being 9 months in the womb of the mother into this liquid, which is a medium, as I said,
Of course.
Transmitting energy,
Of
as I
course.
said, the baby has been absorbing 9 months of emotional stress of the mother, the environmental pressure, and birth. Birth is a big stress. Yes.
Okay.
Even if we say that, well, some opt for section and cesareans,
Yes.
because, yeah, and people say, oh, it's a nice birth because there's no sufferings, etc. I don't totally agree, because I think that natural birth is like the first impulse that we get, the first boost that we get in life. And it's like being born is very symbolic, because every day we may be reborn into projects, into life, etc. So that was a very nice experience with that baby. Another one was with someone who had cancer, and he knew he would die. So he was struggling emotionally a lot with all his pain, physical pain, emotional pain, and you can imagine everything that comes around. Yes. So I was accompanying till the end, and that was a real blessing, because he was able at the end to just put aside the pain body, the physical, the mental aspect, and become just that dynamic stillness. And he could live really the last year in peace, in really deep peace. Yeah. So I also work in the ocean. I take people in the sea and do craniosacral therapy in the water to be in connection with the element, with the ocean.
Sophie, thank you very much for sharing your experience, knowledge, and all you have undergone for the past 12 years as a therapist. It has been a pleasure having you for this episode of Encounter.
Thank you very much for having me. Thank you.
Ladies and gentlemen, we have now come to the end of this program. Thank you very much for being with us. If you have any questions, queries, proposals, suggestions, drop an email. It's encounter@mbc.itnet.mu. Until the very next program, goodbye.